Good afternoon. I'm Nancy Bechtel. I'm Assistant Health Commissioner and Chief Nursing Officer here at Columbus Public Health. And on behalf of our Health Commissioner, Dr. Myshika Roberts, we'd like to thank you for being here today at Columbus Public Health to share the collective work of so many organizations and partners in our community who've joined efforts through CelebrateOne to reduce this county's infant mortality rate. Columbus Public Health has worked for years to address the drivers of infant mortality, and we are grateful that Mayor Ginther has worked tirelessly to elevate the awareness of infant mortality and has expanded city resources to implement key strategies to help all babies celebrate one, their first birthday. Columbus Public Health serves as the data lead for CelebrateOne. We recently released our monthly and year-to-date infant mortality report for July. The county had 8 infant deaths in July, way too many. Any infant deaths in any month is too many. During the last 7 years, however, which is equal to 84 months, we've only seen 5 months with the same number that we've reported for July. Most months are better. All other months have had fewer deaths than this. Today we will hear about the progress we've made and the challenges we still face. So thank you again for being here today and for your ongoing support of families in our community. We're now going to share a video that highlights some of the work that's underway.
And I serve as the Executive Director of CelebrateOne. Since the beginning, Mayor Andrew Ginther has said that our community cannot thrive if our youngest residents don't thrive. Giving every baby the best start at life is why I do what I do every day. At CelebrateOne, we focus on 3 goals: reducing prematurity, eliminating preventable sleep-related deaths, and connecting the disconnected. Since 2015, the staff of CelebrateOne, with our partners, have worked to address and implement strategies set forth in our community plan. We've learned a significant amount from our residents, from our partners, from other cities in Ohio and around the country, and from you. Through our partnership with Step 1 for Healthy Pregnancies, we are able to assist moms with getting into prenatal care early in their pregnancy through 40 OB/GYN practices throughout the community. Seeing a doctor early and often increases the chances of medical issues being addressed and resolved, and allows for referrals to be made of non-medical issues like employment and housing that also impact birth outcomes. A new pilot for 2018 is the Healthy Beginnings at Home program.
Housing is one of the most important elements of babies reaching their first birthday. There are so many mothers that are not in a safe place once they return home after they give birth for a variety of reasons. A safe place to stay, to sleep, to eat, to live, a safe roof over your head is critical to avoiding what can be catastrophic problems for new mothers.
On December 20th, 2017, the Ohio Housing Finance Agency awarded almost $1 million to CelebrateOne to implement their comprehensive program, Healthy Beginnings at Home. CelebrateOne's program takes a comprehensive approach to reducing infant mortality by providing homeless women with housing assistance, medical care, and important social services both before and after their baby is born. At the end of the program, CelebrateOne will help families create a housing retention plan, become more financially stable, and ensure long-term linkages to community supports. Since that time, additional partners such as CareSource, KeyBank, Homeless Families Foundation, the Columbus Metropolitan Housing Authority, and others have added resources to support this implementation. Too many babies die in unsafe sleep environments, and many of these deaths are preventable. CelebrateOne has a comprehensive strategy that includes a media and digital campaign funded with support from the Franklin County Commissioners and the Department of Job and Family Services. Other strategies include training residents on the ABCs of safe sleep. In 2017, our goal of training 500 residents was exceeded. 624 Safe Sleep ambassadors were trained throughout the community and are now equipped with information to help reverse this trend.
I think every community member should know the ABCs of safe sleep, and they should share that message with everyone who has a baby or is in touch with a baby under 12 months of age. And so the ABCs again are: baby should sleep alone, on their back, in an empty crib, and they should share the room and not the bed.
We have to get the word out, and we have to get creative. One approach is the Celebrate Linden mobile app. To date, this application has connected over 1,400 Linden residents to service providers in the community. We have also partnered with PACE to do a community canvas day to raise awareness in targeted neighborhoods. This work is powered by people. This work is also ongoing, and we cannot let up. We are making small changes that will have a big impact. There are neighborhoods in Columbus where there is higher unemployment, instances of crime, and lack of access to nutritious food and health coverage. These stressors contribute to babies being born too small or too soon. Our partners are working to change that. A zip code should not determine a baby's health outcomes. So Connector Corps members work hard to connect with moms and dads in their neighborhoods, meeting families where they are to give them the help they need. CelebrateOne has been hosting community baby showers on each side of town to support families with connections to resources and relationships to support healthy pregnancies and healthy babies. Our first birthday parties give us the opportunity to keep families engaged. We equip families with more resources so their toddlers can continue to thrive during the most formative years of their lives. My statement of hope is for all of us to continue pressing forward. When Mayor Ginther first introduced this effort, his goal was clear: for more babies to reach their first birthdays. This is our collective challenge. Together, we can and must change the outcome for families in Central Ohio, now and for years to come.
Good afternoon. Good afternoon. It is really wonderful to stand at this podium and to look out into this room and see all the individuals that are here committed to this effort of reducing infant mortality. I want to first of all thank the mayor. You know, normally the mayor speaks before city council, but today the mayor we flipped it, and the mayor has such a message that he will be presenting a little bit later on today. But I want to thank the mayor for his leadership in bringing this significant issue to this community and for engaging all the partners to be able to reduce infant mortality. I want to thank Erica Clark-Jones, who is the leader of the city on this effort, and certainly appreciate her passion, which is very clear, and just thank her for her leadership. I want to thank our partner here, John O'Grady, who has certainly from the county, has also very much focused in this work. And I see Joy Bivens, who is sitting in this room, who is partnering with you to get this work done in partnership. So this is certainly a city, a county, a collaboration of our electeds, but also, again, our corporations, our nonprofits, and individuals who are committed to this effort. I am, of course, Priscilla Tyson. I chair Health and Human Services, and certainly I am in partnership with our leadership in moving this initiative forward. The members of Columbus City Council are very much committed to working with CelebrateOne and all of its partners to continue to address the conditions that are leading to high infant mortality rates in our neighborhoods throughout Columbus. As a city, we recognize the role that we play in improving the social determinants of health. For instance, funding for safety initiatives, transportation, housing, job creation, and targeting resources for at-risk populations, including those struggling with addiction, expectant mothers of color, and teen girls. As you may know, I have recently established the Commission on Black Girls to focus on the quality of life of Black girls in Columbus. It is essential that this commission takes into account the impact of teen pregnancy because we know that teen mothers are at greater risk for anemia and gestational hypertension. They're 40% less likely to graduate from high school by age of 22. Less than 2% earn a college degree by the age of 30. 80% eventually rely on public assistance. 25% have a second child within 24 months. And the babies of teen mothers are at greater risk of suffering from health problems and, again, infant mortality. So as we focus on the quality of life of our girls, this commission will address these issues. However, we need the commitment, again, of this entire community to address babies dying before age 1. It will take sustained support from many sectors to reduce infant mortality rate in Columbus and Franklin County and to eliminate these racial disparities that exist. And so today I'm also going to bring to the podium a friend that really needs no introduction, but a friend to our city who's also been a partner to work with me on the local food access plan, which is really also focused on around infant mortality, because we have to make sure that all of our families have access to healthy, affordable, and local food. And John's been such a great partner in that work. And so I bring to this podium an advocate for strong families. He's a dependable guy, and we're so excited that he is our partner, John O'Grady.
Thank you, Priscilla. Thank you. Well, I'm pleased to be here today representing the collective commitment of Commissioner Kevin Boyce, Commissioner Marilyn Brown to continue Franklin County's support for CelebrateOne and the efforts to save every baby. Throughout 2017 and 2018, Franklin County Department of Job and Family Services has supported the development of and distribution of the Real People, Real Stories Safe Sleep campaign that featured families in this community who lost their babies due to unsafe sleep practices. Their bravery and willingness to share their stories helped increase the significance of the ABCs of safe sleep. I'm sure that we can all recite them together, alone, on their backs, and in a crib. But in order to protect our youngest residents, we must continue to reinforce the ABCs in practice. In addition to the campaign, we were able to partially underwrite the supply of portable cribs for families in need. And in 2017, more than a record of 1,430 cribs were provided through 40 community partners across the county through the Cribs for Kids program administered through Columbus Public Health. This represents an 80% increase over the amount of cribs provided in 2016. We know that in order to change our behaviors and cultural norms, like we've done with smoking and car seats, a sustained level of support is needed, and Franklin County is committed to being at the table. In addition to sleep efforts, the Board of Commissioners have invested in the development of community-level interventions that impact social determinants of health, including the Celebrate Linden mobile app, the Franklinton Fuel Movement, and the creation of franklinton.org, and financial empowerment for residents of the Hilltop through a program known as Rise Up Franklinton. On behalf of the Franklin County Commissioners, we are committed to our partnership with CelebrateOne to reduce infant deaths in Columbus and Franklin County, now and in the future. Once again, thank you for having me here today. And now let me introduce our next speaker, CelebrateOne board member and CEO of Nationwide Children's Hospital, Dr. Steve Allen.
Well, thank all of y'all for attending today. This is an initiative that requires the entire community in order to make a difference, and I'm just very gratified to be a part of a group of people like you here in this room who are willing to put the effort in and the patience and resources in order to do what is right for our community. I'm here to talk to you a little bit about the Ohio Better Birth Outcome, short is OBO. It represents the 4th health systems in town, as well as PrimaryOne and the Columbus Public Health. Our work over the past 4 years has focused on 3 specific areas. The first is increasing access to prenatal care. The second is reducing prematurity through perinatal quality initiatives within the obstetrics community. And finally, improving women's knowledge and access to reproductive health services and to contraception. Now, over the past 4 years, we have seen some bright spots. Our community's rate of women delivering babies who receive no prenatal care at all has decreased from more than 4% to now down to 1.5%. We don't believe that in and of itself is going to move the needle, but it is an important component to assure that these women get the care that they and their babies need. We've had consistent efforts around reproductive health education and increased access to contraception at Columbus Public Health, Ohio Health, OSU, and Nationwide Children's Hospital through our clinics, and has resulted in a 3-fold increase in postpartum LARC, which is long-acting reversible contraception, since 2015 to close to 600 women this year. Additionally, gratifyingly, the teen birth rate has continued to decrease from 26 to 18 per 1,000 adolescent women. Unfortunately, there's still much work to be done, most especially in the area of early prematurity, which we define as those babies who are born at less than 32 weeks gestation. Early prematurity is one of the leading causes of infant mortality, and the hospital systems remain committed to coordinating the effort at reducing the rate from where it currently stands in the CelebrateOne target zip codes, at close to 3%, to the national average of 1.5%. Our focus over the next few years will zero in on what research tells us are the most impactful interventions to make a difference in this. One is to connecting at-risk women to evidence-based home visiting, as you saw in the video, during the prenatal period, and continuing until the child's 2nd birthday. Further accelerating access to reproductive health education and contraception to our most at-risk populations, particularly teens and women who are struggling with substance abuse. And then finally, spreading the interventions that have shown success to the community obstetricians who we have yet to fully engage in this important work. Finally, I want to mention something that's not necessarily related to medicine or what we do as healthcare providers, but it's the medical legal partnerships that we have with the Legal Aid Society of Columbus. This initiative demonstrates how healthcare providers are working to impact the social determinants of health known to negatively impact a healthy pregnancy. The medical legal partnership connects pregnant women seen in the hospital clinics to free legal services in areas such as housing, utilities, domestic violence, family law, public benefits, and more. This is a great way to interact with this at-risk population to make sure that we connect them with adequate defense of what their rights are in our community. Since the pilot project started in June of last year, it's provided aid to more than 80 women in our community, and our plans are to greatly expand that number going forward. With that, I'd like now to bring back someone who's already been introduced to you in the video and our intrepid and visionary leader of this great community project, Erica Clark-Jones.
Thank you, Dr. Allen. Thank all of you for being here this afternoon, the last day of summer. Right. We hope. Maybe it'll be 70 degrees when we leave. So, on behalf of the Board of Directors of CelebrateOne, chaired by Michael Fiorelli, thank you for your attendance today and your interest in how our Columbus community can respond to this significant challenge. I would also like to thank the Columbus Public Health Department for hosting us today. In 2017, roughly 19,000 babies were born in Franklin County. 155 babies were lost. While 35% of these babies were born in geographies prioritized by CelebrateOne, 51% of the deaths were to the parents of those infants who reside in those same area, a disproportionate amount. Of all the babies that died across Franklin County in 2017, 10%, or 16 babies, were Hispanic or of mixed race. 36%, or 56 babies who were white, were lost, while 54%, or 83 infants, were lost during the year were African American. The infant mortality rate is measured by the number of deaths per 1,000 live births. The federal Healthy People 2020 goal is 6 deaths per 1,000. Ohio continues to be challenged by high infant mortality rates, as do our counterparts in Cleveland, or Cuyahoga County, and Cincinnati, Hamilton County. Our sister cities also have initiatives similar to CelebrateOne, and we have committed to sharing best practices for successful local implementation. But you can see we all have the same challenge. Since our collective work began in January 2015, the infant mortality rates in Franklin County have statistically been flat, with a slight decline in the infant mortality rate for both Black and white babies. During the last 3 years, our community has achieved the Healthy People 2020 goal for white babies. However, the disparity between Black and white deaths persists, with Black babies dying at almost 3 times the rate of white babies right here at home. Premature or preterm birth are the leading cause of infant deaths in Franklin County. Preterm birth rates have decreased steadily, although modestly, for all races across Franklin County and in the CelebrateOne neighborhoods. Another key driver of infant deaths in Franklin County are sleep-related deaths. Over the last 10 years, sleep-related deaths have declined, with the lowest number of sleep-related deaths occurring in 2017. The prevalence of infant deaths, regardless of race, are more common in 8 neighborhoods that CelebrateOne has designated as priority areas for the last 17 years. The solid red line, or orange, the solid orange line represents infant mortality rates for Black babies across the county over the last 17 years. The solid green line represents infant mortality rates for white babies across the county. And the blue line represents infant mortality rates for all Franklin County babies over that same time period. However, each dotted line reflects the same demographic, but within the prioritized geography, so that you can see place has an impact. The bold lines to the right reflect the dramatic decrease in infant deaths that we need to meet our community goal of reducing infant mortality by 40%. The 2017 infant mortality rates for priority areas are varied, and the young women, men, and families that reside in these areas continue to be the focus of CelebrateOne's work. Our vision is that every baby celebrate his or her first birthday regardless of race, regardless of their address, or their family's income. Our goals are bold and they are aggressive. And with intentional collective effort, they can be achieved in the near future. While infant mortality rates for population specifically are declining slowly, our commitment to narrow the disparity gap is unwavering. Our good work to date and into the future relies on the strength and the reach of our partners in many places, including local and state government, East Central Ohio Hospital System, Ohio Better Birth Outcomes, The Ohio State University, CareSource Molina United Healthcare, community nonprofits, neighborhood organizations, and faith-based institutions. The Greater Columbus Infant Mortality Task Force report outlined 87 key strategies, or key activities in 8 areas to attack this challenge. To date, over 75% of these activities are completed or are in progress. Our strategies are evidence-based, and CelebrateOne believes this work lays the foundation for future progress. To reduce the number of preterm births further, expanding prenatal home visiting, smoking cessation support for pregnant women, and the number of teens that we can reach through peer-to-peer training on reproductive health will be a priority in our neighborhoods and across the county. Through our peers, Central Ohio has an impressive set of social supports for families who can access them. CelebrateOne, with the support of the United Healthcare Foundation, invested early in a network of residents who were trained by the Ohio State University College of Nursing as community health workers. Through this network, we have learned that several pregnant women and women of childbearing age are increasingly isolated within their communities and have a need for just-in-time communications that are accessible and that lead to productive results. CelebrateOne will continue to invest in connecting the disconnected residents of our community to both medical and social supports through multiple modes, including community health workers, Step 1 for Healthy Pregnancy, the Moms to Be program, which is now available in all 8 CelebrateOne communities, neighborhood mobile platforms like Celebrate Linden and Franklinton Fuel, and a new digital resource hub that can be found on CelebrateOne.info's website that is available 24 hours a day, 7 days a week. The social determinants of health, namely education, employment, nutrition, safety, both personal and community, transportation, housing, and a person's relationship to quality opportunities and stability in these areas are the root causes of health inequities. These factors impact a mother's health before she ever conceives a child. Too often, racism and cultural bias play a role in the way in which these resources are obtained and maintained. Our community, focused on addressing system inequities, is required for this work and that of our partners. CelebrateOne is proud to align with the work to reduce, for example, poverty, led by Joy Bivens and Franklin County Job and Family Services. The relentless efforts to reduce the number of Franklin County evictions, yep, we support that too. The movement and campaign to end youth homelessness in Columbus is also related to this work, and so we will align with their efforts. The Columbus Women's Commission pay equity effort for women and women of color is something we align with, and the Commission on Black Girls. All of this work is related to the social determinants of health and improve the quality of life for our families throughout Central Ohio. Before I introduce Andrea Wood, rock star at Community Development for All People, to talk about grassroots efforts on the South Side around social determinants of health like housing, I must take this time to acknowledge the tireless dedication of the CelebrateOne staff and of the health workers. Weekend or weeknight, from the far south to the near east, from Snapchat to Twitter, from the tables at the bean dinner to the auxiliary halls in churches, the women and men make this movement come alive. They are the heart of this work. I would also like to thank Mayor Ginther and our funders for believing in this very important mission. Please welcome Andrea Wood.
Hello. Community Development for All People is an asset-based organization serving the south side of Columbus. We recognize that infant mortality was a significant issue on the south side. As an asset-based organization, we created our first birthday program to celebrate this first birthday milestone with our families. And in doing so, we provide support systems to help these babies get to their first birthday and beyond. In our work with these mothers, we recognize that social determinants of health had an impact on outcomes of the wellness of these infants. Things like housing, access to food, healthcare, employment, and social support really do matter. It was then that we decided to take a resource that we already had, housing, and use it to address infant mortality in our community. With support from CareSource, we did a pilot project called Care Homes with 10 families of mothers who were homeless or at risk of homelessness. The question was whether we could provide enough support around these families in order to affect healthy pregnancy and birth outcomes. Each family was granted a subsidy for half their rent, participated in Moms-to-Be, CareSource Life Services, and they each had a dedicated case manager that worked with them every day. There was a lot of blood, sweat, and tears shed in the last 2 years, and most of it was from me. The Care Home Project taught us many things about how hard it can be to juggle pregnancy and finances, conflict and family issues, responsibilities, and aspirations. We believe the Care Home Pilot Project demonstrated, that providing support at this critical time makes a difference. All 10 babies were born full term. Nine babies were born full weight. 8 of them have reached their first birthday. The final 2 will turn 1 in October. We have a mom currently working on her bachelor's degree. We have a mom and a dad who got married. And we have another mom who began cosmetology school, just to name a few of the outcomes of the Care Home Project. I am thrilled, truly thrilled, to have been a part of the Care Home program and see its concept expanded through Healthy Beginnings at Home. We are on the cusp of something transformational with Healthy Beginnings at Home. I can feel it. I can feel the energy, I can feel the momentum, I can feel the change. I have a question. It is not rhetorical. I am looking for crowd participation. Can you feel it too? Thank you. Next, I would like to introduce Kathy Little. She's a CelebrateOne board member and the Senior Vice President and Chief Human Resource Officer at Worthington Industries.
Can we get her on the resource committee? Good afternoon. I serve as the vice chair for the CelebrateOne governing board, and it's really my pleasure to be with all of you this afternoon. As we highlight the various investments made to reduce infant mortality in our community, we must acknowledge Healthy Beginnings at Home, a 2-year pilot study and housing stabilization program for pregnant women experiencing homelessness. As you just heard, the Healthy Beginnings at Home program is modeled after the success of care homes. Research has shown that a woman who experiences housing instability or a shelter stay during her pregnancy increases her risk of having a preterm birth by 200%. Prematurity, babies born too small or too soon, is the leading cause of infant deaths in Franklin County. In fact, in 2017, roughly 71% of infant loss was within the first 28 days of life. This doesn't have to be the case. Implemented and evaluated thoughtfully, the Healthy Beginnings at Home program can demonstrate the impact of stable housing on maternal health and birth outcomes. As with other programs, CelebrateOne is working collaboratively, including our research partners, Nationwide Children's Hospital and Children's Health Watch, and our Housing Stabilization and Care Coordination partners, Homeless Families Foundation, Step One for Healthy Pregnancies, CareSource, and the Columbus Metropolitan Housing Authority. We would not be able to embark on this important work without the near $1 million grant from the Ohio Housing Finance Agency and the generous financial support from the CareSource Foundation, Key Bank, and others, including housing developers and their leaders, some of whom are with us today. CelebrateOne would like to recognize the Warren T. Tyler Memorial Fund and the Affordable Housing Trust for their generous $100,000 donation. We are fortunate to have members of the Tyler family here today, Marty, Kevin, and Don Shackelford, Chairman Emeritus of the Trust and close personal friend to Warren and his family. It's with deep gratitude we thank you for that support. Additionally, Mr. Bob Weiler, Chairman of the Affordable Housing Trust, is also here with us today. Thank you, Bob, for your commitment to our work on behalf of the Affordable Housing Trust. I would also like to acknowledge our first corporate housing partner for Healthy Beginnings at Home, Bob Schottenstein, and his gift of $50,000. Thank you to Bob and MI Homes for your support. We are grateful for the housing and non-traditional partners who have stepped forward in this space, including Ohio Capital Corporation for Housing, Housing Research Foundation, Columbus Apartment Association, Borer Family Foundation, Casto, Stonehenge, Sunset Development, and the Wood Companies. As the chair of the CelebrateOne Resource Development Committee, we try to model the Columbus way by engaging in public-private partnerships, helping advance the mission and impact of our work. And the Columbus corporate community has responded. Their investment leverages the city, the county, and the state funds to create a more promising future for the youngest and most vulnerable among us, our community's babies. I am proud to announce that in 2017, we met the challenge issued by Mayor Ginther to match the level of investment from our public partners with corporate and individual donations. Worthington Industries is honored to participate along with a notable list of CelebrateOne supporters. A special mention must be given to each of the Central Ohio hospitals who have been with us from the beginning for work that improves clinical efficiencies, the United Healthcare Foundation and Crane Group and family for their investment in the Community Connector Corps, as you heard, is such an important part of the ground game. Nationwide, Huntington, AEP, and L Brands for investments in Safe Sleep, Cardinal Health for their investment in tobacco cessation support for pregnant women, and the state of Ohio, the Ohio Departments of Medicaid and Health for investing in prenatal support programs. I'm proud of this broad base of supporters truly demonstrating the Columbus way. Progress is critical, and we will continue to work together to achieve our community goal, because anything otherwise is unacceptable. And now it's my honor to turn things over to the person who really has led the way on this issue. He has galvanized support. He's rallied all of us to be excited about his goal and his belief in a healthier community for all pregnant women and their hope of celebrating their baby's first birthday. Our mayor, Columbus Mayor, Andrew Ginther.
Thank you, Kathy, and what a better way to celebrate today. There's so many great days I have as mayor, but I feel as if today has been one where the Columbus Way has been part of the entire set of meetings and agenda for today. Just came with a group of faith leaders from the West Side who wanted to know how they could get more involved with the CelebrateOne efforts, and met this morning with leaders from across the community to talk about economic development. And here we report out to the community, you know, if we do public-private partnerships better than anybody in America around economic development, around downtown revitalization and affordable housing, shouldn't we leverage that culture to benefit the youngest and most vulnerable citizens of this community? And that's why I'm so thrilled to be with you today, and I'm grateful for all of our speakers and the incredible work they've done. Since late 2014, we have invested a great deal of resources to reduce our infant mortality rate through the collaborative effort of CelebrateOne. From the beginning, we've had this steadfast partnership from our hospitals, healthcare providers, from county and state government, from organizations in the private sector, philanthropy, and faith community. As we have just seen in the Healthy Beginnings at Home program, public-private partnerships are enhancing the ability of CelebrateOne to bring effective tools into our neighborhoods. So thank you for your commitment, your leadership, and bringing others with you into this important work. The infant mortality rate is an indicator of the well-being of the population of neighborhoods, the canary in a coal mine, that tells us how a community is faring. I never quite grasped when we started this work and movement how our infant mortality rates were a reflection of the disparity and chasm in this great community. They were a very real reflection of how some in our community were enjoying one of the most successful times in the city's history, but a third of our neighbors had been left out of the success story. CelebrateOne, in partnership with all of our other work, with all of the different departments and private sectors and forms of government, is committed, is determined now more than ever to change that story. Because until every family in every neighborhood can share in this community's success, we will not be satisfied. We will not yield. We will not stop. The city is leveraging its resources to impact systemic factors known to influence the infant mortality rates. The social determinants of health have been mentioned before, since we know they really drive this chasm, this disparity. We're getting ready to release a master plan for Linden that looks at transportation, housing, retail, and small business, health and safety, education, workforce. We will start the community-driven process in the Hilltop next week. The Department of Recreation and Parks is building new centers for opportunity in CelebrateOne neighborhoods, combining recreation centers with space for other agencies and nonprofit groups to serve community residents. The CARE Coalition, a partnership with Columbus Public Health, is changing how the city responds to violent crime by providing care and support to individuals, families, and neighborhoods that are experiencing trauma. Family stability and resiliency. That is the goal and the focus. Because environmental factors are affecting the families who experience premature births and infant mortality, implementing neighborhood-level changes like these have to be part of our response to infant mortality. We know that transportation, mobility in particular, is the great equalizer of the 21st century. And we know that barriers can limit access to prenatal care for many women, whether that barrier is the cost, unreliability of a vehicle, or the time required to take a multi-line bus trip to an appointment and back, in some cases with their other children. I'm excited to share with you an innovative partnership between CelebrateOne and Smart Columbus that will support pregnant women in CelebrateOne neighborhoods with transportation for prenatal care. The Prenatal Trip Assistance Program is now in development with Smart Columbus and the researchers at Ohio State. Pregnant women included in the study will receive transportation to and from their prenatal doctor appointments, pharmacy trips, and also be able to pick up groceries to increase access to fresh fruits and vegetables and healthy foods using an on-demand transportation service. The study will support women getting critical prenatal care throughout their pregnancies and continue until after delivery, so that newborn and mom make it to perinatal appointments. The Prenatal Trip Assistance Program is anticipated to launch in June 2019, and at least 500 women will be recruited into the study. Last weekend, I attended a CelebrateOne community baby shower at the Linden Community Center. There were more than 150 families, not 150 people, but 150 families who came, who heard about the ABCs of safe sleep, who now know about the resources in their own neighborhood. The word is getting out about CelebrateOne. Today, we are seeing incremental signs of change. We need to continue this work to bring resources into our neighborhoods. We are making progress in our efforts to reduce the infant mortality rate and to build a future for our youngest residents. And I thank you for all of your continued work in this important arena. Many of you know that I set pretty ambitious goals and aggressive timelines, and I do not apologize for that. Children in this community are counting on us, particularly children of color, to act with a sense of urgency and power, using our collective resources to build a brighter future for them. Now is not the time to yield. Now is the time to press on and engage and challenge our neighbors to join us in this effort. I ask each and every one of you here today to make a commitment to bring someone else into this effort. We're building a movement. This is not an initiative or a program. It is a movement. And you all are going to be able to look back in the years ahead when every child in this community is able to celebrate their first birthday and thrive in their early years of life. It is now my pleasure to introduce a great leader of this work, Artico Coleman, a member of our instrumental and phenomenal Connector Corps.
How y'all doing? Just a little bit about myself. 2016, me and my family, our home was burnt down. We lost our home to a fire. April 2017, me and my family was living in a shelter. I actually graduated Barber College that same month out the shelter. As a homeless father, working barely having enough money to pay my bills. That was my position in life before I received the call encouraging me to apply for the CelebrateOne Connector Corps program. After reviewing the C1 website, I stepped out on faith, completed the application, and my position in life soon changed. As a community health worker working at the Columbus Urban League, I am now in a position to change lives, moms and dads, by connecting them with resources that they need to support them through tough times that families face. I am in a position to show my family and community that I have more to give. Being a part of the Father to Father 2.0 AAMI initiative helped me as a father to help other fathers make great choices in life. Using my training and my own experiences, I'm helping my community by going to the battlefield to stop infant mortality. We at CelebrateOne are grateful for each of you, the partners, the funders, and the community members who support our work. On behalf of our families, we have served and continue to serve every day. And each CelebrateOne connector in the room and those out in the field, we say thank you. want y'all to please enjoy the rest of the day and enjoy the refreshments. Thank you.